Renin secretion. Stimulus for renin secretion. Decrease in BP is the most potent stimulus. Sympathetic stimulation. Decrease in sodium chloride concentration in the macula densa. Renal ischemia. Decreased extracellular fluid volume. The kidney produces the enzyme renin, which acts by converting angiotensinogen to angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by the angiotensin-converting enzyme. Angiotensin 2 acts on the cardiovascular system by causing vasoconstriction, which leads to increased blood pressure. Angiotensin 2 also causes the release of aldosterone, which leads to salt and water retention, which in turn causes increase in blood pressure. Angiotensin 2 preferentially constricts efferent arteriole, resulting in an increased GFR. This GFR increasing effect of angiotensin 2 is lost in case of patients on ACE inhibitors and ARBs. Angiotensin 2 also stimulates the release of aldosterone from adrenal cortex. Angiotensin 2 is formed from angiotensin 1 by angiotensin-converting enzyme in the lungs. Endothelin. It is secreted by vascular endothelium. It releases atrial natriuretic peptide and has a vasoconstrictor effect. It decreases the GFR and renal blood flow. It stimulates aldosterone. Increase in endothelin levels are seen in hypertension, chronic heart failure, and angina. Atrial natriuretic peptide and brain natriuretic peptide. Source: atrial natriuretic peptide is from the cardiac atria. Brain natriuretic peptide is from the cardiac ventricles. Functions: they reduce the blood pressure by decreasing the total peripheral resistance and increases the urinary excretion of sodium chloride. They dilate efferent arterioles, constrict efferent arterioles, relax mesangial cells, and bring modest increase in GFR. Remember that in the brain, atrial natriuretic peptide is present in the hypothalamus. Cerebral salt wasting syndrome. It is suspected when there is hyponatremia in a hypotensive patient due to increased secretion of brain natriuretic peptide.